Hello, Essential Therapy followers. Dr. Cindy Hodgson here, physical therapist, exercise physiologist, and John Barnes, myofascial release practitioner. And I am going to share with you some self-care techniques tonight. I'm really missing my self-care class that we had on Tuesday evenings for the last several months, well, almost actually for a year now. And so I thought I would give us a small class this evening. So one of the things that I've noticed for myself, one of the things I always talk about in the self-care class is that you need to have your minimum, or be aware of what your minimum is for your own self-care, myofascial release self-care I'm talking about now, in a week. So for myself, over many years, and sometimes it changes, and that's what I'm going to talk about, is that right now things are changing, and it can change for lots of reasons, but I know that there are certain techniques that really help me, and one of my favorites is the hip strap stretch series that I use regularly. I know I need to do that a few times a week, and the whole legs up the wall series a few times a week at least. I like to use my foam roller almost every day, and I need to use the small balls regularly, and there's lots of other things that I do too, but we like to put those things together in the classes. But it's different every week, right? So our bodies are different every day, and what we need with them is different every day. But there are some things that carry over and help us with many parts of our body. So one of the things I really was needing today, and this is actually good for me to do before I drive home tonight, are the hip strap series. So now how do I know that's what I need? That's always the question. Well, it's just, I'm familiar with what my body, what signals it's telling me. So let me see if I can put this in words. I'm feeling a lot of tightness through my pelvis area and even up into my abdomen. But I've been having a lot of neck tension and tightness up through here in my upper traps and in my neck. So how is the strap going to help this area? It's a long story as to how I discovered this, and it was just kind of a fluke with some patients that I had about 10 years ago, but this is amazing for neck strain or tension, pain, whatever. I have so many times gotten relief by using this, and I think it's just the whole total body that this affects. And much of this, and tonight we won't be holding these positions super long, but there are some times that I will hold these strap stretches so long that I'm getting maybe even 5 minutes in one position, so I'm really giving that opportunity for a myofascial release, because we know that we need the good 5 minutes for that collagen to change shape. That's the plastic portion of our connective tissue. And so if we're able to hold things longer, that's fantastic, but you're still getting benefit if you're holding these positions less than 5 minutes, because you're still getting into that range of motion that maybe you haven't been in all day. So I'm going to do some positions with this that I know I have not gotten to today, even though I did an exercise routine this morning. So I even did a 30-minute weightlifting routine that was nonstop and had lots of stuff in it, but there were several positions that I did not get into with this strap. So often I will look at everyone in the class's leg length and take a quick look at their pelvis, tell them where they are. Oftentimes people are a little bit off on their leg length. Of course, that's not because the bones are different lengths, but because the fascia is hung up throughout the body. And then we come around later after we're done with the hip strap series, and oftentimes, almost always really, the leg length is back to normal or almost normal. So we're gonna start with the strap, and this is a yoga strap. I like to make the loop small in the end, so have that sitting near you. We're gonna start by just connecting in, because whenever we wanna do self-care technique, one of the acronym that I use is CALM, right? C-A-L-M, so C is to connect. So we're gonna take a moment and connect with our body, okay? Then we're gonna do some assessment, then listening and moving, and I'll talk us through that as we begin. So start just by lying down on the floor. Make sure you have your strap nearby. Now, if you're someone who needs to have support under your knees, when you're lying flat, please put a pillow or something underneath your knees. We're gonna start by just lying here, let your body rest on the floor. Take a deep breath. And just start to be aware, what do you feel? What part of your body is touching the floor? You might notice that the position of the right leg is different than the position of the left leg. Maybe it feels like one leg is rotated more. So if you even take a moment and look at your feet, see if you can feel that difference. So for me, my left foot is rotated out compared to my right. But I feel a big difference between the left leg and right leg. It feels like my left leg is closer to the floor than my right. And then bring that awareness up into your body, a little higher into the pelvis. You might feel that one side of your pelvis is more on the floor than the other. As you move it up into the low back, you may notice that the small of the back is up from the floor, and that's totally fine. It's normal to have a little bit of curve or arch here with the lumbar area. Now, for some people who are really tight in the front area here, it may really be pulling up, and so you may actually feel some discomfort in the low back area here. So just be aware of what that feels like, because we're going to assess this at the end. So this is part of our assessment. We're just feeling what's going on in the body. And notice the difference between the right arm and left arm. So for me, I can tell a big difference here. My right shoulder feels like it's higher. My right arm is laying differently on the floor. And really feel into your chest and your shoulder blades. Just be aware what it feels like. Feel your neck. Do you feel any strain there? Now, real important here, notice your head and neck position. If your head is tilted back like this so that the chin is up quite a bit, then what you want to do is grab something to put under the back of your head, okay? So you're elevating the back of your head and bringing that chin down. You don't want to be like this where your head is tilted up either. You want your head to be in a position where the chin is pointing straight up but perpendicular. If you were to put a line through the chin, it would be perpendicular to the floor. So hopefully that makes sense. So you don't want to be tilted back and you don't want to be too far down, just nice in the center. And take a few deep breaths here. Feel the abdominal area rise with your inhale and fall with your exhale. And just connecting in. If you take some time and make it a habit to really assess your body before you do any self-care, you will begin to notice a difference. And that's what's so helpful in learning what works for you. So we're going to now take the strap. And it doesn't matter which leg you start with. In fact, you can also kind of ask your body as you're sitting here connecting, which leg do I want to start with? Whatever works for you. So I'm going to go ahead and start with my right leg. And what you want to do is place the strap around the ball of the foot, because if you're at the arch of the foot, it pulls differently. So we're going to go at the ball of the foot, and we're going to let this leg come down straight. And we're not going to go through the whole series of arm and leg lengtheners right now, because I'll talk you through it as we're here. But what I want you to do is pull the toes back towards you, let the leg come down. Looks like I'm not quite in the middle here, so I'll move up so you can see a little better. So we want the left leg to be bent, and the right foot is, the toes are pointing back toward the head with the strap around the ball of the foot. Make sure that knee is straight, and take a moment to lengthen your right heel away from your body like someone's pulling it away from you. And you're reaching and lengthening, and from here, we're going to walk your hands up the strap, lifting the leg up. And then relax it down. So just do a couple of rotations here. Let's do an inhale, lifting the leg up, and an exhale down. And one more time. This time we're going to hold in the up position. And we're going to reach that right arm up, and I like to reach up real high at first because I want there to be a tension developed between that strap and my leg and my arm, so that my arm is straight and the tension between the leg and the arm is actually creating a little bit of an arm pull here, and I'm feeling the pull in my leg because of holding the strap. So as I relax, what we don't want it to look like is this. This is what I mean. So see how my elbow's bent? I'm not getting a stretch here. If I go like this, and this may be why I'm getting some relief up into my shoulders and my neck. So we want to make sure if we're able to incorporate this arm position that we can. So just begin to hold here. Now, let's play around. Make sure you can settle into this. Notice that my knee is straight. I'm going to actually give myself a little bit more room, let my leg come down a little bit more. Because it's not about how far you can go back, it's what you're feeling. I can feel some good tension here. So I'm going to let the left leg straighten out. Now, if you can straighten out the other leg and still keep this knee straight, great, then you can do that. You can bring the leg down. Now I'm also going to do a leg lengthener on the left. I'm going to pull the left toes back towards me and reach the left heel away. Now I'm lengthening the left leg away and I'm lengthening the right heel up away from the floor. Now we're going to take the left arm. We're going to do an arm lengthener. I'm going to take the palm up just like you're going to do a snow angel. You need to scoot that snow out of the way. The arm has to be on the floor to do that, right? So I'm going to let the arm scoop out to the side now. If I start to have pain in the shoulder or anywhere else, that's where I'm going to stop. I'm going to back off a little bit so it's not painful. I'm going to leave it there. If you can go further, keep going until that arm starts to come up off the floor. So I can come all the way up here and my upper arm is still on the ground. However, if I was here, that would be too far up. So you're going to bring the arm down and lengthen through there. So wherever you are, you're going to reach your fingertips away, reach your heel away, and breathe. So connecting again, and we're assessing here, and we're also listening. So what is your body telling you? Is this a little bit too intense for you right now? If it is, we're going to move out of the position, okay? If it's feeling okay, then you can stay here and breathe and relax into it. So we've got a couple of minutes into this position here. Connecting into your breath. We're going to move along, slowly letting the leg come out to the side to the right. So I'm going to bring the leg down. Now, wherever you need to stop, you may need to stop here. And what I like about being next to the wall, I just wanted to show you this. If you struggle with the position and coming out to the side, you can always position your body so that you have something to rest your leg on. So check this out. I can bring my leg over here. Now I can even let go of this strap completely if I want to, but I'm going to hang on to it just to get that stretch into the ball of the foot. Now I'm using the wall to support me, and this feels really great. I can really let go here. I'm still lengthening the arm and leg on the left. Now you can make this active for quite a while with the opposite side, or you can just let your arm and leg be here and then relax it and keep them in that position. So you're still straightening out the area. I'm going to go back to the center position because I want to have a full stretch here. So I'm going to let my leg come down even more. Okay. So another way that we can position the strap, because sometimes holding this strap gets to be a little bit, tiring on your hand. So I'm going to take the left hand and I'm going to bring it overhead. Now this is only if this is available to you with the shoulder motion, can you do this? But I'm going to take the strap around my left hand and bring the left arm over my head. And so this feels so good. My right leg is going out toward the wall. My left heel is reaching away from me. And now this is opened here and my elbow is bent, hanging onto the strap. And now I'm getting a nice stretch into this whole left side of the body. And just closing my eyes and letting myself soften and relax into it. So again, continue to listen to your body. So here we are, we're always assessing what's going on because there's two ways to do this. We don't have to assess, right? We can be thinking about all kinds of things right now. You can be thinking about what you just saw on the news, God forbid, which will not get you in any kind of relaxed situation usually. Or You can be thinking about what you got to do tomorrow or something else. I mean, there are a million things, right? And so when we do that, we are disconnecting from our body, and we're not feeling what's going on. So you must stay feeling what's happening in your body. So even though you're listening to me, and even though I'm talking right now, I can still feel and connect in what's happening here. So allow yourself to assess what's happening now. What's going on in your right leg? How is your left leg feeling? Do you need to change anything? Do you need to move? That's our M in calm, right? So from here, now I could stay here longer, but we've been here a couple of minutes. So we're going to bring the right knee in. So this is kind of a moment to take a break, right? You can just kind of bring the knee into the chest. You can stay here for a moment. You can even do circles with it. But we're going to splay the knee out to the side a little bit. So you're going to push it toward the armpit kind of. And then you're going to lift the foot up. So some of you may need to bend the knee here, and that's fine. Some of you may be fine with it straight. But we're going to start with it bent here for a moment. Now, notice how I'm rotating the leg out. Bottom of the foot is pointed up to the ceiling. My knee is bent. What we're trying to do is get this shin straight up and down, okay? This feels totally different than this, okay? So as best as you can, here, maybe you have your elbow down to the floor, you're holding onto the strap like this, or you may be able to even reach the outside edge of your foot, and then let's straighten out the left leg. We're doing that left leg lengthener again, and then we can even bring the left arm lengthener overhead. Now you'll see that this leg is up quite a bit for me here. It's because I have tightness in the front of this hip. So anything that's tight here as I'm in this position is going to be getting stretched. That's why I want to have this leg down if I can, because it feels really good, and it's giving my hip, it's opening the front of my hip, which is a good thing for my hip right now. So breathe into this space. Wherever you feel, it's going to be different for everyone possibly. And now from here, if your leg is still bent, you're going to want to straighten it. As we do this, you're going to take your left hand and grab the strap. Let the leg come down. Left leg straightens out. Now you're going to let the right leg come across your body. I always wrap the strap around my hand. Let the leg come across. And in this particular one, it doesn't matter if you go with a full straight leg or with a leg that's bent. Now you'll see there's quite a big difference in both of those positions, knee bent or knee straight. Let this arm, the right arm, come out to the side. Turn your head and look over toward the right hand. And play around, again, continuing to connect. And play around with bending the knee a little bit more. Like when I bend the knee a little more, I feel it completely different in my hip. Where do you feel it? Here we are connecting again, assessing. You might be getting some information for your next technique that you're going to do. If you're doing this at home and you're figuring out what should you do next. For example, I feel some tightness in my right shoulder right now in the front of my shoulder, which is telling me I probably should do the foam roller, which I wanted to do anyway. So that's listening. Okay, now with this twist, some people have a difficulty really letting this pelvis come up and getting into the low back. Again, always listen to your body. Never do anything that's painful. You must stop at your edge or before your edge. You don't want to go into a level of discomfort because the fascia is going to react to that and it's not going to be a release, okay? So from here now, we're going to come around onto the left side. And I'm going to turn my body onto the left, and then I'm going to turn the strap around. So it's at the ball of the foot still, but now I'm going to point my toe. And I've turned the strap around. I'm going to take it. This is really hard to watch on video, so that's what's nice about a class is I come around and adjust everyone with this particular one. But now you're going to bring this over your shoulder, kind of like you're carrying a bag over your shoulder, okay? And the reason why I do this here is I want to put pressure on the upper trap. So this is giving me a release here, which feels really good. Now, watch my thigh. I don't want my thigh to come up like this. That's kind of cheating. As I make sure that my pelvis is perpendicular to the floor, so I'm not rolled back this way and I'm not rolling forward either. I'm perpendicular to the ground. I let that knee come back and I try to keep the thigh parallel to the floor. Now, here's the thing. There can be a lot of knee discomfort here for some people. It's not about how much you're bending the knee. I can straighten my knee a little bit. So see, I have a good, even just 90 degrees bend. It doesn't have to be bent like this, okay? Doesn't have to be. It's all about where your comfort is. So I'm going to bring my knee flexion to about 90. Keep my thigh parallel to the floor and then bring it behind. Be mindful not to arch your back a lot in this position. You want to keep your abdominal area engaged if you can so that you can feel the stretch all through here. Most people feel it there. Some people will feel it in their back. If you do feel it in your back, try to change your position of your back a little bit and see if you can take the strain off a bit. So we won't stay real long here, just enough to really get into this position. Now, before we come out of this, think of your knee. Remember how we were doing the lengthener with the leg and the heel? Think of your knee lengthening away, like someone's pulling the knee towards the door, or toward the wall. And when I do that, I feel that up into my pelvis in a little bit different way. Lots of times during these self-care classes or self-treatment, I will feel the desire for a nice big deep breath, and really that is connected to the releases that I'm feeling in my body as well. So if you feel that, that's a good thing. So we're going to come around and take the strap off the foot now. Come back to your center, and before we go into the other leg, take a moment to connect again and feel your body. And already this feels completely different for me than when we first started. I'm feeling my right side is positioned different on the floor than it was just however many minutes ago we started this, okay? So be aware of that. Now let's take the strap to the left foot. Again, on the ball of the foot. And right knee is bent. Pull the left toes back towards you. And then walk your hands up the strap. Let's just do a couple of motions here. You may notice that this side feels different than the other. That's very typical. And just some nice deep breathing. And let's hold this last one up here. Reach up high with your left hand. Wrap the strap around your hand so that your arm is completely straight. You may need to adjust it so you get it just right. And make sure that the knee is straight as it comfortably can be without really locking it out, but nice and straight. And then if this feels comfortable, you're able to keep the knee straight, and see if you can straighten out the right leg. And we're going to do right leg lengthener. Pull the right toes back towards you, reach your right heel away from the center of your body, and then snow angel that right arm up, remember, along the floor. Don't just flip it overhead like this. You want to do that snow angel position. It changes how the shoulder is moving. And get to the furthest position that you comfortably can without pain, and that upper arm still on the floor. Reach and lengthen through the fingertips. Reach and lengthen through the right heel. Breathe and soften into this position as best as you can. So I feel that even all the way into my head right now. It's part of listening to your body, assessing where you're feeling things. Feel. Lengthening through the left heel, through the right heel. And you can also relax that other arm, that right arm and leg, and just let them be relaxed on the floor. And from here, let's let the leg come out to the side, toward the left. And remember, you can always position yourself. Get a nice view of the bottom of my foot there. Position yourself so that your leg can be even supported like on the ottoman or the sofa or the wall like we did over here earlier. Now I'm going to bring my right arm over my head. I'm going to take the strap into my right hand because my left hand's getting a little tired. I'm going to bring this head or my arm over my head. And now I'm getting a really nice stretch through the whole right side of my body, through the rib cage, between the rib cage and the pelvis. And I'm reaching my right heel away from my body. Often checking in and seeing where you can relax. Just a little bit more. So always listening to your body when you're ready to come out of the position. I'm just adjusting my strap here a little bit. And I will often take my hand, if I have my one arm over the head like this, I'll take I'm taking my left hand and supporting the strap a little bit more, because you can get fatigued in your hands as you're holding the strap. So from here, let's now bring that knee in. So taking that break, a little bit of a rest here, and then splay the knee to the side, and then lift that foot up. So remember, you might need to bend the knee, and maybe you can grab the outside edge of your foot. If not, and you're holding onto the strap, rest your elbow on the floor and then wrap the strap around your hand. So you're not straining very much with that left arm. I'm going to grab the outside edge of foot and straighten out my right leg. So this is really opening the front of the right hip here. You can see the thigh is reaching toward the floor, but there's quite a bit of space there. And I'm going to reach my right arm into a snow angel, arm overhead. And I'm also taking this left foot, I'm pushing into, it's kind of like a push-pull thing, but not real active. I mean, I'm just holding it steady. But this is actually lengthening my shoulder blade. My arm is completely straight here. So if you don't need to keep your elbow on the floor, but you still need the strap, you could position it so, like with the leg in the other position, you're actually lengthening into this arm. So whatever works for you. So this is what I call the half happy baby, because in yoga, when we do both legs, it's happy baby. So if you happen to have a long yoga strap, I can talk you through doing this with both legs. This is a 10-foot yoga strap, which is my preferred length to use. Let's see if we've held this long enough. So if you're not able to get fully into a position where you can grab the edge of the foot, you're going to still use the strap, okay? But we're going to bring both legs into this position now. So
here's the tricky part. We're gonna take this long, long, long strap. Now if you have 2 yoga straps, you can just do that, or you can use, some other type of long rope belt that you might have, like to a robe or something. So I take the other end of the strap and I make sort of a makeshift loop. So see how I have this here? I'm gonna grab this, and now I've made another little loop. Okay, so I'm gonna take that onto my foot. I'm gonna take this onto my foot, the legs are straight, bend them, and now we have full happy baby. My elbows are supported on the floor, so I don't have to strain my shoulders, but yet I'm holding the position. So it gives you a little bit more motion. You can go all the way up here. You can even turn this into a supported straddle with the straps. Of course, we do this against the wall with legs up the wall a lot, but it also feels really good here. So we're gonna go back to happy baby. As we're here, think about the tailbone and bringing the tailbone toward the floor and lengthening the back of your neck. So think of the crown of your head reaching away from your body, and think of your tailbone also reaching away from your body. Lengthen the back of the neck and breathe. So I add the happy baby, the double position, on the second leg. And you could do it on the first leg if you wanted. You could do it on both of them. But I just wanted to save a little bit of time, so we're doing it just here. So go ahead and release. We've still got the main loop on the left foot, so we're gonna keep it there because we gotta do our twist. So left arm comes out, shoulder level, let the left leg go across the body. Turn and look over to the left hand. And again, remember the knee can either be more straight or more bent. You can play around with the position, which is what I usually do. Find a few different positions that I like, and I can really feel this one in my shoulder blade right now on the left. So really try to think of that left shoulder blade pressing down into the earth. And I'm able to rest my left foot on the wall here, which is really nice. And let's talk about listening again. So as I'm listening to my body, I'm really feeling this area again, the front of my shoulders, which is foam roller, right? I know I can get to this with the foam roller. I'm also feeling a lot right here in this hip. Feels good though, it just feels like a really good opening. But I also feel the center of my chest. So I think of this as the heart center because it is the heart center, but also a little bit lower is our solar plexus area, so I'm feeling all of this in here. Very much an emotional center. So, we've started talking about this a little bit more, how much the emotional system is connected into our fascia and into our body. And there's been a huge disconnect with this in medicine because medicine doesn't want to deal with the emotions and so on. They keep that separate as a separate field, but it's all here. It's all in us, in our being. So oftentimes as I'm doing self-care, I will feel emotion come up, and I will feel it first in my body as a sensation, often in my chest or in the solar plexus. So if, just explore that. I'm going to be quiet for a minute or two and just see if you can breathe into that space. Just be open to the idea of feeling here. It's okay if emotion comes up. Allow yourself to feel it so that you can let it go. Okay, so taking the strap again, and now we're doing the front of the thigh. Remember how I turned the strap around? We're going to roll over onto the right side of the body. And so it might help to take a moment just to see this from the back. Remember, try to keep the thigh parallel to the floor. Bring the strap over the shoulder. This is what it looks like from the back side. Bring it over the shoulder, and then you're holding on to the strap in front around in your belly area. And then it's not about how much you bend the knee, remember. In fact, my knee has been strained a little bit recently, so I need to make sure I'm not bending too much. And keeping the knee or the thigh parallel to the floor, and then reach it back. Keeping the pelvis parallel or perpendicular to the floor, straight up and down. And being mindful not to arch too much in your back. I'm going to go ahead and release this now. As we come back around onto your back, and let's see what it feels like now. Both legs out straight. That feels completely different. Well, first of all, I can tell my shoulders are more even. They're closer to the floor in general, but my right side is not as different as it was initially. So, and my legs are feeling differently. So just notice how it feels different for you after doing that routine. So from there, we're going to move along, and I'm going to, if you don't have a foam roller, you can take a towel or a blanket or a few towels, roll them up like so, and have some sort of makeshift foam roller, okay? If you do have a foam roller, we are not going to be rolling. We're just going to use this to support our back. So you sit on the very, very bottom. So this is the biggest mistake I think that people make, is when they first sit on it, they sit like about here and then their head is hanging off. So we don't want that. You're going to scoot all the way to the bottom. Make sure your feet are wide enough apart so you don't feel like you're going to fall off. And then slowly lower down. And you get yourself situated so that the foam roller is right down your spine. And let the legs come wide enough so that you don't feel like you're going to fall off. Let the arms come out to the side. Now, if this is too uncomfortable here, you can support under your arm with pillows or folded blankets or towels, whatever works for you. And just settling in here so the head is on the roller. I really feel this in my shoulder blades right now. But wherever you feel it is just where you're tight. So I'm feeling this also in my chest and the front of the shoulders, and I'm going to just settle in here. One of the things you can do if you don't have timers set up to tell you exactly how long you're here is to count your breath. Really connecting in with your breath, slowing your breath down. You may even notice how many counts it takes to breathe in, or you may just decide you're going to count in or breathe in for a count of 8, let's say, or a count of 6. And breathe out at least for as long as what your inhale is. So if you're breathing in for a count of 6, you want to breathe out for at least a count of 6. You can breathe out for a count of 8 or 10 if you like, but it needs to be at least 6. And then you could count how long or how many breaths that you want to stay there, especially if you're doing 2 sides to something. If you start to feel some discomfort or pressure that's building, tune into that area first and see if you can soften a little bit. Can you let go a little bit more somewhere? See if that helps. Something to keep in mind here is the arch of your back, and most everyone will have some space at the low back that is not touching the foam roller, and that's fine. That's the normal lumbar curve. In fact, we could do a whole series of working neutral or finding neutral spine on the foam roller. But if your back is, I'm going to exaggerate mine right now, if your back is really arched here, that can cause some compression in the low back. So you want to think of lengthening the spine or tilting the pelvis. You may even want to lift your pelvis up and then lower it back down, trying to lower down 1 vertebrae at a time and decrease that arch that's there as much as you comfortably can, more to a neutral spine. So as I'm assessing and listening here, I can tell that my right side is definitely tighter in the front of my shoulder and chest area. And so I might not have time to do this next technique on both sides if I was doing this at home. I would pick, as I'm lying here on this roller now, I really need a little bit more attention on the right side. So if you can tell one side, it could be left side or right, doesn't matter. That's the side you're going to pick, because we're just going to do one right now. And if you want to pause this and do the other side, that's fine. But what I'm going to do is, it's not about rotating the head. It's about lifting and shifting. So if you want to work your right shoulder a little bit more, you're going to follow me. If not, you're going to go to the opposite side. So I'm lifting my head, I'm shifting it off to the side a little bit, my nose is still pointing straight up, and now I feel that right shoulder blade is pushing into the foam roller a little bit more as my head is tilted off of the foam roller. I'll move my hair so you can see. So I'm tilted off and back, and the arm is out to the side on the right, and as I let go of my hair here, and just softening in. I really feel this foam roller is like pushing my shoulder blade, my right shoulder blade, toward the wall, which actually feels very good. And you can kind of settle into this, move, whatever feels comfortable. So if as you're here you soften and your head begins to move and it feels comfortable and safe, that's great. If you need to support your neck, please do so with any type of a folded towel. So it's not, your head should not be falling way down over here, okay? So it's just a little bit, it's just a little shift off to the side. You can also use a yoga block here, sometimes that's the perfect height. So you could, from here, after doing this side, you could lift your head back to center. See, actually, boy, now I feel tighter on my left, so I am going to do a couple of breaths over here on the left side. Lift the head and shift it off. And really pushing into the edge of the left shoulder blade. Feels really good. So remember, all of these positions, sometimes it may feel like a little bit of discomfort is going on, but it shouldn't be pain. And really, I like to think of things as a sensation that is not pain. You know, years ago, I may have even thought of this as discomfort, but this feels so good to me right now. And this is what happens often as you learn to do self-treatment. You realize that your sensations change and how you perceive what a technique is doing for you. Okay, so back to the center here. And then to get off of the foam roller, you're just going to roll off to your side like so, and then roll that foam roller away from you. So now it feels probably even more different coming off of that foam roller. Let's straighten out the legs. Feel your body lying on the floor now. Feels so different than when we first started this. For me, I hope it does for you. We're going to do a technique with the ball. So if you don't have a small ball, actually I'm going to use two right now, into the buttocks area here. You can find something else to use. I've had people tell me they've used socks, like roll up a pair of socks and have a nice big heavy ball, or you can fold a small cloth, washcloth, and put that inside of a sock also to make it a little bit more firm. Be careful how hard of a ball you're using, because sometimes they're just too firm. And I have lots of firm balls, but I will use those for different areas of the body. So you just want something to be comfortable. So be aware that the reason why we use these air-filled balls is that they are fairly squishy. So, and you can, I have several of these at home where some of them have more air in them than others. So just be mindful of how you're going to do it. So we're going to place these balls on the back body, and we're going to do them in the buttocks area, but you're going to make sure that they're right across from each other, because if you put one higher and one lower, that's actually a self-treatment for a pelvic rotation, which is something we're not going to get into. So you're going to make sure they're right across from each other. As I lie down here, lift the bottom up into a little bridge and right across from each other along either side of the sacrum. Find a spot that feels good. So I'm going to play around with this a little bit to get just the right spot, and there we go. So we're going to start with the feet wide apart, and then let the knees fall in together. And, oh, that feels really good. So this may be where I begin, but play around with positioning and see what works for you. You may also want to have the legs completely straight, and that's fine too. So find a position that you like. I'm going to go back with the knees bent, and we're going to settle in here for a few minutes. This is a good time to connect in with your breath. Feel the breath rising and falling. Abdominal area expands, and then the rib cage, and then the chest. And as you exhale, try to let the chest fall, the rib cage, and lastly pull the abdominal area in. And wait for that next inhale. After the exhale, the body rests until it needs to breathe again. I like to think of that space between the exhale and the inhale as a point of true rest. Really keep reminding yourself to soften here. It's really easy to tense. As you let go, you might feel your body moving around a little bit. You might feel that pelvis rocking back and forth or settling in. We call that unwinding. It's a good thing. Just let your body soften into it. Take your brakes off and let the body move. We're mostly water, so think of water balloons. They kind of move around. And as we're shifting things with these tools that we use, we can have some movement happen in the body as it's releasing. I just felt my neck lengthen there, and my sinuses open. Go figure. It's all connected. That's part of listening, feeling the changes. More lengthening in the spine, feeling the need to adjust my position, and actually feeling my body sink even more toward the floor, the top of my sacrum and the low back. Notice what's happening in your body. So we've been here 3 minutes. Take a little bit longer. Notice those spontaneous deep breaths that occur, usually around a good release. So now let's slowly lift the pelvis up, remove the balls. Let's do a body scan again. Just notice if you feel even more changes, little things happening here and there. Okay, so I want to end with this over the shoulder upper trap stretch with the yoga strap. So we're going to open this. Okay. So actually this is a little bit big for me. I think about it. I've done this so many times. So it's a nice big loop. And the trickiest part is setting this up so that you can adjust it easily. So here's the loose end. I'm going to have that, throw that back behind me. I'm going to roll onto the floor, and the knees are bent. So now I have my circle, see? I'm hanging on to the buckle with my right hand. And the end that I want to pull to make it tighter is going toward me, toward my head, okay? So I'm going to put my knees into this. Now I'm going to put my left arm through the strap. And here's the tricky part. You don't want to just stop right here at the very edge of the shoulder. You really want to lift up. I even use my left arm, I'm going to stretch this out a little bit, to get this behind my shoulder blade. Do you see that? I'm really putting it around there. I'm putting this around my upper trap. So once I've got it there, that feels so good. So here's the thing, you have to change. I recommend playing around with I've got my buckle here right now. I just opened it up, and I can tighten it up, and I can release it all with my hand on the buckle right there. And find a spot where it's around your knees. The legs are not really doing much in here actively. They're just kind of hanging out. But just how you have it positioned, gravity will pull the legs away enough to put some pressure here in the upper trap area. I've got my arm out to the side. That makes a big difference. And you can just relax into this. Now, you can push the legs over to one side. I usually like to bring the knees a little bit to the opposite of the shoulder that I have the strap on. And then you can play around with pushing one knee away from you. Notice how, like, on my left side here, I push the left knee away, I can feel it pull a little bit more on the back side. But if I release that and I push my right knee away, I feel it a little bit more on the front, which is where I've been feeling this kind of a lot. Or you can just push both knees away and you've got both of them. So there we go. If your neck or head feels like it wants to move while you're doing this, just explore that. I just needed to relax a little bit more. I didn't realize I was tensing there through my left arm, and just reminded myself to let go again. And my neck just released a little more. But look, I don't have anything touching my neck. I just have this around the shoulder, and I just felt my neck release. If you have this position of this set up properly, you can really let go and relax here. I have completely fallen asleep in this position more than a couple times. So it should feel really comfortable. So play around with it so you get it right. Now to move this to the other side, you can keep this position, but I'm just gonna take it off of my left shoulder, just like you're putting a bag on the other arm. So you're taking the bag off of this side, and you're putting it on the other side, your gym bag or your purse, or whatever you wanna think of it. This over here, duffel bag, and I really use that other hand to push it behind my shoulder blade, okay? Really get that whole position, or the whole edge of the shoulder blade there. And I just needed to adjust this a little bit over here, bring my right arm outside, shoulder level, and play around with, if you want one knee pushing away a little bit more than the other, and letting the legs go on a tilt. And just play around with it so you find that position that really works for you. So these last couple positions, I'm really starting to feel an awareness of the front of my face here, between my eyes, my forehead, this whole area. So since I'm really working on the right shoulder and my left arm is just kind of hanging out, I'm going to take my left hand to my face and just do, intuitively, we have an awareness. Have you ever had discomfort and just put your hand somewhere? Turn that into a release. Just connect with it and take up the slack in the tissue. So I'm just putting my fingers at the base of my eyebrow here. I'm connecting in toward the bone, toward the floor, and up toward my hairline. I'm just holding my hand here. It might look like I'm just holding my head. Well, I am sort of, but I'm making it a release as well. Wherever you can connect with the body, take up the slack, feel a pull, you can turn it into a release. Just remember, it should never be painful. We never force anything. We allow it. Allow it to let go. Which actually can be harder than you think. Because we often are blocking it from within. Consciously holding and whatnot. You can also turn this into a hair pull. Hair pull. What's a hair pull? You just grab onto the hair, take up the slack, hold it. Another good deep breath. And so we're going to go ahead and release this now. Just lying on the floor again, connect in. How do things feel different for you? And from here, you can continue to listen and assess. If you have more time, what is the next thing that you could do? And maybe you don't have an awareness of that yet. Maybe you don't know what you're actually feeling or where you could go. Just try something. And then while you're doing that technique, you're continually connecting and assessing and listening for what you're feeling. Allow yourself to lie here and rest a little bit more if you like, or maybe take it to the wall, do legs up the wall, a couple of positions, and allow yourself to continue to release and relax, let go, and connect to your body. I hope you enjoyed the self-care class. It's not the same as having people here with me where I can go around and help them and adjust their bodies, but I actually got treatment with this one even though I was talking, and it felt really good, so I hope you got something out of it. Remember to always connect with your body. Don't ever force anything, and it should all be comfortable. Have a great night, and feel free to comment, connect with me at Essential Therapies, 419-344-2223. We can text us there and comment and share. Thank you.